Tonight, Ballad Health officials and health systems across the country say they're dealing with a nursing shortage, reducing their ability to provide care. Tonight, Ballad says in addition to that, more than 100 people are hospitalized with COVID-19 in the system. They're fearing that number could go higher, up to 500 patients within the next few weeks.
And our frontline healthcare workers will feel that pressure. Today, News Channel 11's John Janko talked with Ballad Health's chief nursing executive about what a nurse experiences during a COVID surge.
It has been a difficult and frustrating summer for Ballad Health nurses. Exposures and infections for some means hectic, inconsistent hours for others. Working long shifts for an increasing number of patients with severe symptoms has taken its toll, and they are doing this with even fewer nurses than at the start of the pandemic.
Ballad Health's chief nursing executive Lisa Smithgall says the recent surge of COVID-19 patients has put some Ballad workers in unfamiliar conditions.
Nursing leaders of the units sometimes work and step into staffing and have to work alternate shifts to help take care of patients as well. We also have some of our clinical educators who also end up having to help staff.
But as COVID patients fill beds, having those workers help on the clinical side hurts efforts to fix the staffing shortage.
And that takes them away from the other duties that they have, like working on staffing and hiring new staff.
Smithgall says Ballad has used a large number of contract workers to fill the staffing gap. Nurses wear varying levels of PPE depending if they are working with COVID patients during a shift, but some nurses are not vaccinated. Nurses must pick up shifts when coworkers start experiencing symptoms from COVID. That means schedules that often change to meet needs.
We do a lot of juggling sometimes, and we move people from their scheduled shifts on days or nights to an opposite shift, a different day of the week, to cover the immediate need.
Smithgall says nurses in Ballad's rural hospitals may work with a mix of COVID patients and regular patients. Some nurses in the larger hospitals may work exclusively with COVID patients in a surge. The amount of patients assigned to a single nurse depends on the level of sickness.
Some of our COVID patients are much sicker than our other patients, which would require that you have a little bit less patients to nurse ratio.
But that ratio gets incredibly difficult to properly fulfill as Ballad expects a massive surge in the coming weeks.
We're going to have an expanded role of nurses taking greater patients per nurse, and we're going to have to try to supplement that with assistive personnel who may or may not be normally in the clinical environment.
Today, Ballad announced they will try to bring in retired nurses to help out its full-time nurses. Smithgall says this is kind of like a support role. The retired nurses won't be working full-time shifts, but they'll help with smaller things like admissions and discharges from the hospital. In Johnson City, John Janko, News Channel 11.
Ballad is hoping the experience of those retired nurses means they can join their workforce in that support role quickly.
On your screen, a number that you'll be able to call if you are a retired nurse and you are tonight interested in coming back onto the job to help Ballad as they deal with COVID-19. A nursing shortage is being felt not just here in our area, but across the Southeast, and that means stiff competition for available workers. Smithgall says many nurses want out of clinical settings because there are more opportunities for them outside of hospitals. Several nurses have entered the contract labor force because they say pay is higher. Smithgall says a second surge could even further weaken Ballad's workforce.
That is a great fear for us, that if we get to another surge, that nurses who maybe made it through the first surge and saw some improvement and saw some light potentially at the end of the tunnel may just think, I can't do this again.
We've learned Ballad Health has offered increased incentives, but many have considered work-life balance more important. Those incentives include sign-on bonuses to bring in experienced nurses and scholarships toward a degree. They're hoping the incentives work and help bring Ballad closer to a full workforce.
And Ballad leaders expect the next few weeks to be troubling, contributed to being short-staffed and a surge fueled by the Delta variant of the virus. Here's the state of the healthcare system now. They have 125 patients in their hospitals with confirmed cases of the virus. 11 more are awaiting test results. 33 of those patients are being treated in intensive care units. 17 are on ventilators. Right now, the average positivity across the region is at 15%, and it could be between 18 to 20% in some areas.